All right, we are here with another MAPS moment. This is my interviewee, Wesley. Wesley, can you introduce yourself?
Absolutely. Wesley Portegies, Chief Strategy Officer and founder of MedComms Experts.
Wonderful. Wesley, what are you most excited about with MAPS this year?
Well, first of all, it's wonderful to see how big this actually has become. I got to know MAPS about 8 years ago, a pretty small group of people. So I've been here from the beginning, and there are, I think, 1,400 people this year. And I'm just impressed with how this community has come together. And, we're working hard to show the value of what we do in medical affairs in the industry.
For sure. What do you think this means for the future of medical affairs?
Well, I believe that the future of medical affairs and specifically medical communications isn't about creating more content. I think it's really about communicating more effectively. And I think the pharmaceutical organizations that are going to win this game, they're going to be the ones that actually have a strong model in place to scale that communication effectively, to create kind of a cohesive orchestration across all the different activities they do, because we have had a wild grow of new channels, new formats, and new ways of disseminating and consuming content. But there doesn't seem to yet be a lot of orchestration between all those activities. And of course, we're all counting on AI. But I actually personally believe that AI is going to make it a little worse before it gets better, because it's going to lead us to actually create even more content. And that will expose the actual problem, which is it's not about more, it's about better and more effective.
Thank you so much. Catherine, can you introduce yourself for us?
Hi, I'm Catherine Graham. I am an MSL at Dompay.
Wonderful. Catherine, can you tell us what have been some of the biggest highlights or takeaways from the sessions that you've attended so far?
Absolutely. The biggest takeaway that I've experienced so far is from the Insights Masterclass at MAPS, and that is related to the AI framework that we went over and how to effectively design an AI prompt beyond the couple of sentences of, can you please give me this? You really want to include things like context, audience, and be very detailed in the output that you're expecting so that it comes out in a format that you would like and do not have to correct.
That's wonderful. Thank you so much, Catherine. Okay, we're standing here with Kristen at MAPS. Hey, Kristen, what are you most excited about that you've seen on the schedule? What talk?
I think all the different tracks are really great. There's such a variety of options to attend. I just got out of an insight session, and that was phenomenal. I'm looking forward to bringing back a lot to our medical team at Recordati Rare Diseases.
Is there any one specific thing that you think your team will be excited to hear about?
I think they'll be really excited to hear a little bit more about the insights process and how it can be integrated within multiple departments.
Awesome. We've got Adiola and Becky with us this time. Adiola, can you introduce yourself?
Yes, my name is Adiola Davis. I'm a Senior Director of R&D Learning and Development at Acadia Pharmaceuticals.
Great. And we've also got Becky.
Hi, my name is Becky Porter. I'm Associate Director of Medical Learning and Capabilities at Servier Pharma.
Great. So Adiola and Becky, along with Katrina, just finished up a great talk on AI. Adiola, what were some of the key takeaways from this talk?
Just the enthusiasm around all of the wanting to use AI with L&D. I think people are ready to go. And so when they came to this workshop, my takeaway is that people want to feel very empowered to be able to move AI forward at their organization.
Yes, for sure. How about you, Becky? Any highlights?
Yeah, I mean, I think people understand about AI, but I think people are using it personally. But I think what this session really helped them understand is how they can use it in their role, particularly as L&D. I think there were people who had very aha type of moments in terms of seeing what the capabilities were and really understanding how to work with the fundamentals and how they can take that back and use it in their roles.
Great. And we had some great discussions at the tables today. Thank you so much. We've got Kevin. Kevin, can you introduce yourself?
Hello, my name is Kevin Laguerre, and I'm from Biogen.
Wonderful. Hey, Kevin, what are some of your key takeaways from the sessions today?
I'd say some of the key takeaways, particularly from the session today, and I don't think anybody will be surprised here, is really the scale and the adoption of AI within medical affairs. I attended a few sessions today really talking about that, and I think what's been fascinating is we're no longer in a space where we're trying to introduce AI. We're in a space now where teams really need to adapt it and as well as run away with it. So I've sat in some really cool and interesting sessions about that.
Fantastic. Thank you so much for joining us. All right. I've got Michael with me now. Michael, can you introduce yourself?
Hi, I'm Michael Kahn with Amicus Therapeutics.
Hey, Michael. All right, Michael, our question is, what do you think about the new debate format at MAPS this year?
I think the new debate format is terrific. I think it's freed people up to express a point of view in a really authentic and deep and passionate way that we haven't seen before. And so the discussion that goes on between an opening statement and a rebuttal and then the audience participation, we've really seen levels of transparency and frankness. It's really refreshing. And so I really think it's a great addition to the format.
Wonderful. Thank you so much. I've got Evan with me. Evan, can you please introduce yourselves?
Hey guys, I'm Evan Reddick. I lead leukemia, myelodysplastic syndrome, and myelofibrosis for Takeda Oncology.
Okay, great. Evan, can you tell us what does MAPS mean to you and how did you get involved with MAPS?
Yeah, MAPS is really special. MAPS is truly the Medical Affairs Professional Society. I got involved with MAPS many, many years ago. I attended a Launch Excellence Masterclass when I was in my first ever global director role. It changed the way I thought. I was able to come back to my organization after that masterclass and implement some of the things I learned that augmented the way we launched globally. And I'm super thrilled to still be a member of MAPS. I'm the strategy domain lead here at MAPS as well in some volunteer efforts. And we're leading a panel discussion later today where we're going to show how we can operationalize medical affairs metrics. Because as we learned from our keynote speaker, if you don't count it, it doesn't count. And what is counted has impact.
Great. Thank you so much. Today we've got with us Angela. Angela, can you please introduce yourself?
Hi, I'm Angela Valadez with Regeneron.
Great to have you here, Angela. Angela, can you tell us some exciting takeaways or any key things that you noticed from the session so far?
Yeah, I feel like overall the sessions have been so productive and positive, and I think it's just from the speakers themselves all the way to the participants in the interactive workshops. It's really, I think my key takeaway is there's a lot of passion in this area and a lot of interest in AI, and we're all trying to figure out how exactly to utilize it.
Right. Thank you so much. My next interviewee is Ralph. Ralph, can you please introduce yourself?
Yeah, hi, I'm Ralph Roars. I have my own consulting company. It's called KAL P&R Consulting. I'm been in medical affairs arena for 31 years, all 31 years focused on field medical.
Wonderful, Ralph. Ralph, what are some highlights you've had from the sessions or any key takeaways you want to share?
I'll tell you the biggest thing that I've seen is the evolution of artificial intelligence. You can't really go to many meetings in any sessions without AI being mentioned. Actually, I was just came from a debate which said, will AI replace medical affairs?
Right.
A very interesting debate. At the end of the day, it won't. I really believe in people and the work we do in medical affairs. However, using AI will help to augment what we do. We'll have increased productivity. People will still have jobs, but they'll be able to be much more efficient in what they do.
Yes. Thank you so much. All right. I've got my next interviewee. Can you introduce yourself, please?
Of course, I'm Josh Yoder. I'm an MSL team lead with KZ Global Rare Disease.
Wonderful. Great to meet you, Josh. So, Josh, what has been some of your favorite takeaways from the sessions that you've attended so far?
Yeah, started with the opening session, which is a great overview of kind of problems in healthcare, the way AI is addressing, how to use that technology to make it more human. I went to a workshop kind of on career development. And for me, largely, it's how do I teach my team? How do I support them in their career development?
So what do you think this means for the future of medical affairs?
Yeah, I think obviously AI is here.
Yes.
And I think we see the same kind of trends in a lot of places. AI is not going to replace jobs, but the people that know how to use AI are going to outcompete the ones that don't. Sure. That's a huge part of it. Sure. And I think that ongoing just evolution, the career development part, they were talking about a lot from moving from competencies, which really encompass a lot of skills, to actually very specific skills. And I think maybe a year and a half with a new technology is already making you an expert and qualified to do kind of another role that you might not have done before.
Awesome. All right, last question. What are you most excited to take back to your team and share with them?
Yeah, I think obviously for my team, again, the career development type stuff. I've managed multiple teams now, and I often get that question, train the trainer from my perspective, but now I know how to go and talk to them about it.
Yeah.
And beyond that, again, I think it's the technology, the trends.
Well, thank you so much. This is a little MAPS minute for everybody. Thank you, Josh.
Thank you.
Bye.
Transforming Medical Communications is brought to you by MedComms Experts. To find out more about MedComms Experts and how we create some of the most cutting-edge medical communications programs anywhere in the world, visit www.medcoms-experts.com. And then make sure to search for Transforming Medical Communications in Apple Podcasts, Spotify, and Google Podcasts, or anywhere else podcasts are found. Make sure to click subscribe so you don't miss any future episodes. On behalf of the team here at MedComms Experts, thanks for listening.